A gastric balloon is a device which is placed into the stomach of the patient in order to help them lose weight. It's a simple device such as this. It's delivered into the stomach using an endoscope, which is a long camera inserted through the mouth when the patient's asleep. The sedation that we use is usually fairly light. The patient does not need to be under a full anesthetic, it's not necessary. Sometimes we do choose that depending on the situation, but generally it's done with sedation. The procedure takes about 10 to 15 minutes, it's very quick. The balloon is actually deflated, and once it's inside the stomach, we then inflate it up to a volume. So what you see here is a 500 ml volume balloon, and it works simply by occupying space in the stomach of the patient, giving them this feeling that they are full, or perhaps they eat less to feel the same degree of fullness or satiety. It's a non-invasive technique, it doesn't involve any cutting. It's something which is certainly very successful in terms of its outcomes, and on average patients would be expected to lose 10 to 15% of their total body weight. Now, of course, there is no guarantee of that. The amount of weight that an individual loses depends on other factors as well, such as their compliance with diet, such as their continuation of their exercise regime. So it's really one of these approaches which is helpful for patients, particularly perhaps at the lower end of the spectrum of BMI. The cutoff tends to be around about 27 and upwards. Most patients that I put balloons in have a BMI of between 30 to 40. They can be used in patients that are much heavier than that, but then that's often as something referred to as a bridge to other therapy.